Is microneedling another aesthetic trend, or is it really worth the hype? Does it rejuvenate the skin, or does it help regrow hair like they say that it does? Today, we're going to talk all about that, what it is, how it works, what you need to know before you do it. Let's get into it. Microneedling is exactly what it sounds like. You utilize either a pen device, which is usually utilized in an aesthetic clinic, or a roller device, which you can utilize at home. And they have these tiny little needles that cause what we call controlled injuries or controlled traumas to either the skin or the scalp, wherever it is that you're using them. These micro traumas cause the body to heal itself naturally. When the body heals itself naturally to these micro traumas, you get collagen formation and growth factors coming into that area that allows for the rejuvenation of the skin in that area. Now, when it comes to skin, you get benefits for improvement in fine lines and wrinkles because, again, you get that tightening development with collagen formation in this area that allows the sort of skin to improve on its own naturally. What you could also do when you're applying micro traumas with either a pen or a or a dermaroller, excuse me, while microneedling is various serums. So, for instance, hyaluronic acid is a really great serum to apply while you're doing a microneedling session to the face, or using PRP in conjunction with it is really a great option when you're using a microneedling session. That's usually a very beneficial package to do together, because what that allows you to do is to take those serums or that PRP and penetrate it even further and deeper under the skin where those currents are channels are being created with those needles, allowing for that serum and that PRP, whatever it is that you're utilizing, to penetrate deeper into the skin to allow for more beneficial results in the long term. I do want to make note. A lot of times you'll see PRP being used in microneedling, and they call that the vampire facial. And you're going to see a bloodied face. It doesn't have to be bloody. A little bit of redness is absolutely fine. It means you're going deep enough. If you're bleeding profusely, it means you're going too deep, and that is causing too much trauma to the skin. So a red flag you want to look out for when microneedling. Now, let's talk about microneedling and hair, okay? There have been studies done that show that when you microneedle into the scalp and utilize PRP or minoxidil, okay, you actually have better penetration of those things into the scalp. And what that does is it actually helps improve dormant hair follicles. It stimulates dormant hair follicles and wakes them up and allows for improvement in hair growth and hair restoration by utilizing this treatment. If you're using microneedling on the scalp, it is important to know that you do have to go deeper than if you're using it for the face. Usually going 1 millimeter to 1.5 millimeters is optimal, just so that you get better penetration into the tissue in that area. Now, I do just want to make a note, if you are going to use minoxidil after doing a microneedling session, sometimes it is best to wait about 24 hours before applying the minoxidil, simply because once you microneedle the scalp, it can sometimes cause irritation if you apply the minoxidil too quickly afterwards. So just giving it a little bit of that wait period is okay. Just give your skin a little bit of time to heal on its own, just to prevent any type of irritation. So just see for yourself what works best for you. Risks to monitor for. Microneedling is not without risks. It is a medical procedure, okay? If you're doing it in an aesthetic clinic, you want to make sure that your microneedling pen is always appropriately sterilized. You want to make sure that you're using caps that are individualized. You want to make sure that the pen is always clean. You want to make sure that there's no leakage from any serums or treatments that you had from your patients before. If you're using a derma roller at home, please, please, please always make sure that you sanitize your roller appropriately. Read the instructions from your manufacturer. Make sure your skin is always clean before utilizing any treatments, before applying anything onto your skin. Make sure that you use a really good cleanser to make sure you removed any makeup, any creams, any ointments, anything else that you previously had on your skin. If you are someone who has a history of keloids or gets hyperpigmentations from skin procedures, this is something that you have to watch out for, okay? Because these are micro traumas, the risks are smaller, but they are not zero. So if you are susceptible to getting keloids, I would, definitely speak to your medical provider before doing one of these treatments, because again, if you're doing this on the face, you're doing these essentially needle injections throughout the face and throughout the skin. So you don't want to risk getting keloids essentially everywhere, because that can be very difficult to manage afterwards. Microneedling is not a one-time treatment. It needs consistency in order to work. If you're doing microneedling by itself, or with, let's say, a hyaluronic serum, you can do it once a month for the skin. If you're utilizing it with a PRP treatment, you could do it once every 3 months for the skin. That is a really good sort of time frame for it. If you're using a dermaroller at home to do it, remember to keep it shallow, only to 0.25 millimeters, and you could do it every 2 weeks at home. That's absolutely fine. If you're using hair treatments and you're just doing microneedling, you could do it once every 2 weeks. If you're doing it with PRP, there are PRP protocols that you can use, but you can discuss it with your clinic where you're getting it done. So a couple of things you should know that maybe are not super well known. Don't use ice when you microneedle. It will constrict the blood vessels. Don't use numbing cream for too long. It will also constrict the blood vessels. The face does not bleed as much as the scalp. So if you do, a facial microneedling and then you decide, you know what, I'm already here, why don't you also microneedle my scalp, and you notice that the scalp is bleeding more, totally normal. Scalps always bleed more than the face. Don't freak out. It is expected. Pens are better than rollers. They just go deeper. They are more precise. And usually if you're using a pen, you're having it done by a professional who hopefully knows what they're doing. And that would be, the better route. But if you've got a good roller and you've done it before and, you're on top of things, God bless. Just please make sure you don't overdo it. You don't want to cause scarring tissue on your face if you just dermaroll too much. So just something to keep in mind. So in conclusion, microneedling is not magic, but it is effective if it's done right. Okay, so if you found this helpful, or if you have any questions, please let me know. Drop comments down below and let's talk some more. Let's keep learning.